Thank you very much for joining us this afternoon. My name is Erin Murphy. I'm a state representative from St. Paul. I'm also your MC for today. I am here with some Minnesotans. They are named Kelly Martinson, Kathy Rayfelt, and Andrea Sorum. I will introduce them again. Clark Johnson and I are here today to talk with you about our concerns about House File 5, the Republicans' bill dealing with reinsurance in the individual market. The proposed plan for reinsurance fails a number of simple goals that we have in place for health care in Minnesota. The Republicans' plan is incredibly expensive at about $300 million, and it requires no commitment from insurance companies to reduce premiums for Minnesotans, to provide stronger networks for Minnesotans across the state, and to provide them more choices and options for coverage. The Minnesota Care Buy-in is a tested and trusted plan that will extend affordable coverage to thousands of Minnesotans by providing access to stable, statewide networks. The plan that we're going to talk about on the floor today is really a plan that extends a benefit, reinsurance, for powerful insurance companies without any commitment to the affordable coverage and health care for Minnesotans. It's time for us to come together around solutions that work. For too many years now, at least 6, we have been in a standoff over health care when we have the know-how to provide solutions. I hope that this legislature, moving forward, gets that right, that we begin to work together again on solutions that will provide affordable health care for the people of Minnesota wherever they live, so they can see the doctor or the nurse and get to the hospital and know that they can pay for that care. And with that, I would like to first introduce Kelly Martinson. She will be followed by Kathy Rayfelt, and she will be followed by Andrea Sorum, and then Clark Johnson, and then we'll take questions. Thank you very much.
Hi, my name is Kelly Martinson. I grew up in rural Minnesota, but I live now in St. Paul with my husband and 4 kids. Thank you for letting me share my healthcare story with all of you. In the year 2000, just 2 weeks into the lovely journey of parenthood, we ended up with a baby, our son Espen, in the hospital. 5 days in the pediatric ICU and 5 more days on a regular hospital floor. The bill was $50,000. Our share was $0. My husband was a teaching assistant at the University of Texas at the time. We looked at the bill, and then we looked at each other, and we swore that we would always, always make sure, whatever life threw at us, we would have excellent health coverage. And we have kept our end of the deal. When we moved back to Minnesota in 2006, we purchased the best possible health insurance we could. My husband was a stay-at-home dad at the time, and I'm a freelance writer, so we didn't have any employer options to get health coverage. In 2006, our premiums were roughly $350 a month, and our deductible was $5,000. Over the last 10 years, we have watched our insurance premiums more than quadruple. They are now nearly $1,900 per month. Our deductible has risen by 150% to be $7,600 a year. For those of you doing the math, our premiums are nearly $23,000 a year. And we're one of the many not-so-lucky families that reach our deductible every year within just a few months. That means our total yearly cost for health insurance is $30,000. Espen gave us about 9 years of relative calm before he was diagnosed with a brain tumor at age 9.5. Although his brain tumor was operable, it left him with some challenging side effects. He doesn't have peripheral vision on his left. He has also a battery of medicines he has to take to replace all of the hormones that your pituitary gland makes. One of the very important hormones the pituitary makes is growth hormone. You need this into adulthood, believe it or not. When Espen first started on growth hormone, our insurance company denied coverage, even though our policy covers 100% after our deductible. Growth hormone was and is an exclusion on our policy. But remember, it was the best possible health care we could buy. With the passage of the Affordable Care Act, our insurance company was required to cover his growth hormone. We are terrified that if the Affordable Care Act falls apart, we will lose this coverage. For reference, growth hormone on its own costs $70,000 a year. Without that coverage, we risk bankruptcy. We are stuck in the middle. We make enough money that we do not qualify for MNsure subsidies, but we have to purchase individual insurance because employers are no longer offering benefits. After Espen recovered from his brain tumor, My husband returned to teaching college. Every semester, he's asked to teach classes at one of the universities in the Twin Cities. Every semester, none of them will offer more than a semester-long contract, thereby allowing them to avoid paying benefits. We're a family that makes an average of $100,000 to $120,000 a year and still lives paycheck to paycheck. $30,000 for health insurance takes quite a bite out of that pretty quickly. We're in a cycle of simply trying to stay afloat. Without being able to buy into Minnesota Care, we cannot continue to live in Minnesota, the place where we grew up and have chosen to raise our children. We will be forced to relocate to a state or country that offers universal health care. After being in the trenches for the last decade, constantly fighting with our health insurance company to get them to cover the things that our policy should cover, it's clear to me that they do not have the best interests of Minnesota at heart. A Minnesota Care buy-in option will provide all Minnesota families a secure place to land when all other options become truly impossible, which I fear they will. Thank you.
Hello. My name is Kathy Rayfelt. I live in Millville, Minnesota, which is in Wabasha County, down near Rochester, in an area where we have more expensive health options and less choice. My husband and I are both in our early 60s. I retired several years ago. My husband worked as a software engineer, and during his employment, we had excellent health coverage. We had no deductibles. We had $10 to $25 copays for office visits and prescription medications. We were secure in knowing that our healthcare needs would be met. In 2010, I was diagnosed with early breast cancer. I was treated and have been cancer-free for the past 6 years. We planned and were hopeful for his early retirement, but as time got closer, we learned that my short bout with cancer would most likely mean that I would be denied for private health insurance. The efforts in the last few years to provide protections and opportunities for all Americans to have affordable health insurance and access to health care have been extremely important to us. When the Affordable Care Act passed, my husband was finally able to retire. We used COBRA to buy our insurance for the first year, which cost us a little under $1,000 a month, which was a big expense on a fixed income, but it was good insurance, and we had budgeted for that. The following year, the ACA went into effect. We could have continued on COBRA for another 6 months, but that premium had gone up to $1,400 a month, so we opted to apply for MNsure. While the process was new and frustrating, we were able to get insurance and a tax subsidy. We're just under the limit. So our cost was approximately $700 per month. It was half the price of COBRA. The following years, so we've been on MNsure all of the years since its inception, and the following years, our portion of the premium remained pretty stable. Until October of 2016, just prior to the election, we received a letter from our insurance provider, Medica, stating that the policy we had purchased through the MNsure exchange in 2016 would no longer be available in 2017. They offered us a comparable plan that they felt would meet our needs at a cost of $2,842 a month. Even with the estimated tax subsidy, we couldn't afford that plan. The plan also did not qualify for a health savings account, which we had established to deal with high deductibles and copays. After checking into what we might be able to get on the individual market, we found no better solution. So we opted for a less comprehensive plan. We went from a silver to a bronze. Our deductibles increased to $6,400 per person, or $12,800 for our family. It turned out that the tax subsidies had increased, so our actual premium was actually still fairly low, and I have to say that the Affordable Care Act worked very well for us. But this whole situation makes me a little angry. I'm a taxpayer too, and when I see the amount of the subsidy that we get, and I know that that's going to the insurance companies, it's pretty easy for me to see who the winner is in this system. But we don't have any other option. Even after we selected the lowest cost plan that would work for us, without our subsidy, our annual premium cost would be $24,000 a year. and add in another $12,800 for deductible if we actually had to use our insurance, and our healthcare costs would be $37,000 a year. That doesn't work on a retirement income. I know there are people who did not qualify for assistance, like our previous speaker, who are already paying those kinds of costs. And for insurance that's less protection than we've had in the past. For the past couple of years, I've avoided doctor visits. I've chosen not to fill prescriptions because of the extremely high cost. And on one occasion, I actually chose not to seek out emergency hospital care. I'm here to tell you my story, but I don't think my story is all that unique. I'm asking you to oppose the reinsurance bill being considered today. It gives hundreds of millions of dollars straight to insurance companies without assurances for how this money will improve premiums, deductibles, and provider networks. Does it make any sense to pay out money and hope you get something in return? I believe that this plan is fiscally irresponsible. At the very least, if these protections are going to be provided to the insurance companies, I would urge you to not only strengthen the level of accountability, but also consider protecting the people of Minnesota as well. I ask you to support the option for the Minnesota Care buy-in. Minnesota Care is an established insurance program that already works for many Minnesotans. With all the uncertainty at the federal level on health care, we need to make sure that Minnesotans have access to quality health coverage at reasonable prices. An option to buy into Minnesota Care is a good way to do that. At least we know what we'll get for our money. It would seem to me that it would also provide some level of competition and hopefully cost control to the private insurance companies. If the federal government doesn't have the courage to address our health care in a serious way, perhaps Minnesota can be a nonpartisan leader in moving one step forward to a real solution. A reinsurance plan that gives all of the money and the control to the insurance companies with no guarantees about what they will deliver is not the right direction. We need a healthcare system that prioritizes the healthcare needs of people and makes sure that we can all access good insurance coverage and good healthcare. Thank you for your time. Our lives depend on it.
Hello, my name is Andrea Sorum, and I am a mother, a single parent, and an independent musician working in South Minneapolis. And although I have more than enough work every week, and I charge some of the highest rates of active musicians, I still cannot afford private health insurance for my family. I really, really love being on Minnesota Care. It is good coverage for my kids and I. And like most independent artists I know, I need it to be government subsidized. Without government subsidized healthcare, almost every artist I know would be forced to choose between their career and a job with health benefits. And for those of us with kids or with pre-existing conditions, there would be no choice. I know if I buy a car or a house, it is the right and responsible decision for me to insure those assets through private insurers. But as a vulnerable human being and a mother, I am responsible to the Commonwealth, and the Commonwealth is responsible for me and my kids. It is the right and responsible decision for us as a state to insure each other, to protect each other from financial hardship during illness or because of an accident. Expanding Minnesota Care to every Minnesotan would grant more entrepreneurs and artists like myself the opportunity to contribute to and grow our vibrant small business and artist community. It is the wrong decision to help only the health insurance companies. If we really want to be a compelling destination for investors, travelers, and families, we must support those who make Minnesota unique and bring connection, spirit, and life to our communities. The Minnesota legislature is not merely making a budget decision. They are making a culture decision. They are choosing between corporate welfare on one hand and small businesses and artists on the other. I support the Minnesota Care buy-in option. Thank you.
I'm Clark Johnson. I represent District 19A. I live in North Mankato. The stories we just heard are echoed across the state of Minnesota. I heard similar stories throughout the campaign, and it's for that reason that I submitted House File 92 to establish Minnesota Care as a buy-in option for folks like these in the individual health insurance market. It's a matter of really giving Minnesotans a choice in that individual health insurance market, a choice that they know, that our neighbors know. We all know people, rural Minnesota, we all know folks who have had good experiences with Minnesota Care. It's another choice on that list that they can choose from as they go into that individual market and determine how they will provide for health care for their families. It offers strong networks. It could be offered in all counties in Minnesota and would have no caps. So every Minnesotan would have at least one option going forward in this fall when they enter that individual health care insurance market. I'm glad HF5 is on the floor tonight because it gives us an opportunity to offer this as an amendment to that bill so we can do this right and do it now and make sure that we've got a market that works for Minnesotans that includes a buy-in to Minnesota Care. We're open for questions.
Federal reinsurance and other programs that expired within the last several years were, by all accounts, pretty successful in tamping down costs. Why is that the wrong approach here in Minnesota now?
I will give you this response. This is from my view. I think reinsurance can be part of the package. I really think it can. But there's two significant problems with it that are straightforward. One, it costs a lot of money. The fiscal note on that bill is really high. Hundreds of millions of dollars. Do we have the ability to keep pumping that kind of money into the system? The second problem is accessibility. We don't know if what private insurers, even with the reinsurance program, will enter the market. Contrast that to the Minnesota Care program. If we can secure a waiver for Minnesota Care as a buy-in option, we know it costs about $12 million to set it up, and after that, no more cost to the state, to the taxpayers. I think that's very significant. And furthermore, again, it would be offered in every county. Every family that's in that market would know that they could select Minnesota Care as their choice for their family. It would be one of the options, and perhaps the only option they would have in order to secure health stability for their family.
When we heard this bill last week in the Finance Committee, the Council of Health Plans brought this chart for us. You may have seen it before. Insurance companies within the individual market set the premium rates, and they're the ones that ask for enrollment caps. And they testified that in 2014, when MNsure began, they offered premium rates the lowest in the nation. The next year, third lowest in the nation. The next year after that, the eighth lowest in the nation. This year, we're about two-thirds of the way across the nation in terms of cost of premiums. We asked them repeatedly if we did this mechanism of reinsurance in House File 5, would those premium rates come down? They can't answer that question. Would we improve the networks? They said they were uncertain. Would people have more choices in the market? They don't know the answer to that. As we head into a floor debate over House File 5 today, when we are here saying it is our job together to make sure that Minnesotans have access to affordable health care, we are on the edge of spending $300 million on a reinsurance mechanism that has no guarantee for the people of Minnesota in relief that they're seeking. That's our objection. We think we're offering something better with Representative Clark's bill, House File 92, which is a tested and trusted program, 25 years in the making, Minnesota Care. We already know that there are networks across the state of Minnesota. They're stable. And we know that the premium rates of about $450 a month are really affordable for people. And we want to have that debate in this legislature with the Republicans, not an ideological debate, but instead a debate about the solutions that are going to work for Minnesotans. And we think Representative Clark Johnson's idea is a good one.
What about the objection that provider reimbursements are too low in Minnesota Care for it to be successfully expanded? And has there been an effort to raise those provider reimbursements in this bill or in this amendment?
That's a fair question. And as we know, that's true. The rates are lower. So I did a little investigating. I talked to the president of a hospital, a small hospital in my district. And he said, we can work with the lower rates, What really hurts us as an enterprise is when we get somebody coming off a car accident or a severe cancer patient who we know we have to provide very significant care to, who do not have insurance. And but that's really and I get that. That makes sense when you think about it. You can budget for the rates. You can't budget for the car accidents. And when folks show up at his hospital without insurance, that's the financial bombshell that they really have trouble dealing with. And so I think over time, we can work on the rates. That's a separate issue. But the main thing is we've got to protect our providers from instances where people are needing care and don't have insurance. And that's the real problematical charge or cost of health care to our providers. And that's what this Minnesota Care Buy-in will provide. It will give people an option. I anticipate more people will find this attractive. More people will enter the individual health care market so that hospital and other providers in Minnesota will have less instances where they have to cover the cost of that. And I think that's really significant.
And I would at all realistic this year, given that there's a Republican-controlled Senate and House?
I'm going to say yes, it is. And I'm just going to state that because this is the point. The governor supports this, okay? There's 45 authors in the House on this. Senator Tony Laurie is the champion in the Senate. And, you know, Tony Laurie understands health care and health insurance well. There's a lot of folks on our side of the aisle that are saying this. I think I certainly enter this session, and I think a lot of us, and I hope all of us enter this session in a spirit of collaboration, cooperation, and compromise. In many ways, I see this as part of a compromise. We are seeking to attach the Minnesota Care Buy-in to House File number 5 as part of that bill, both routes moving forward into conference. And I would hope that the conference committee would hold vigorous hearings, learn about both of them. Representative Davids in the public has acknowledged that he's not sure how the reinsurance works. There are questions about Minnesota Care Buy-in. We've got this month to very vigorously get after this, learn about them both, and come up with a final product that works for Minnesotans. And I think a final product that works for Minnesotans will include the Minnesota Care Buy-in.
So in what way have you changed the buy-in to compromise with Republicans and win Republican support?
I'm sorry,
You said that everyone comes in looking for compromise. In what way have you compromised on the Minnesota Care Buy-in to receive Republican support?
well, I think, I'm not saying everyone comes in with compromise. I said I hope everyone do. I certainly do. And I'll tell you, this is what we all did here. I don't think that, I knocked a lot of doors. I knock all my doors. And if there's a common theme when I hear it at the doors, and I've heard this from colleagues too, and that is that, hey, get along with each other, work things out, compromise, cooperate. And I think this is a genuine effort. Again, this is being attached to we're seeking to attach this to the bill that has the reinsurance. I fully expect to support that bill if this amendment goes on. In a spirit of compromise, in a spirit of collaboration, I think a lot of members will. I would suggest that if Representative Davids wants a strong House position, it will be with this both tracks going forward. Picture that going into the conference committee. I have had the opportunity to speak informally with a number of my Republican colleagues. I've asked them to be open to it, and they agree to that. They're very open to it because they've also heard the same things we've all heard. This is a real problem in Minnesota, and we need a real solution to it.
And to the earlier question, Lori, your question, I think that when I look at House File 5, they're using the Healthcare Access Fund to pay for that. They're taking the 1% premium tax and diverting it to this idea. So we are cannibalizing, if you will, Minnesota Care to be able to pay for this for people that make more than 400% of federal poverty. If we left Minnesota Care and the funding source intact, we could use that to increase rates in Minnesota Care to Medicare rates. We could absolutely do that. And I know there's openness to that. They almost got all the votes they needed in the Senate for that idea just last week. We have been stuck ideologically in healthcare, and it's time for us to move beyond that. And we are coming to this press conference with a good idea. And I think Minnesotans, whether Democrats or Republicans, come together around a good idea. And Representative Clark's idea is worth consideration, and I hope the Republicans find their way to that as well. Thank you.